Tonight, we start with a challenge for millions of Americans and hundreds of thousands right here in Michigan: rising healthcare costs. Many are starting the new year with the fear of losing coverage as it comes with the subsidies put in place during the pandemic, expired the first of this month. 13 on your side's Peter Elliott joins us with a story of one local woman who relied on those tax credits. Peter.
Lauren, health insurance premiums have soared in recent years for Americans across the board, whether they rely on private insurance or have a plan through the public marketplace. But the rising costs are particularly acute for those who rely on subsidies to pay for their coverage through the Affordable Care Act. Millions of Americans, like Rebecca Perrin, have a devastating choice: an expensive plan or no coverage at all.
My jaw was on the floor. I was like, this is outrageous. Who can afford this?
The cost of coverage is simply too much for Rebecca Perrin.
The price more than doubled.
With subsidies for the Affordable Care Act lapsing in the new year, the Wyoming resident is among the millions of Americans facing higher health insurance premiums.
I think of, my friends that have families that don't necessarily qualify for Medicaid, and they're now facing this.
Perrin works as a ticket agent for Indian Trails, the bus operator. She likes her job and the pay is fine, but healthcare isn't one of those perks.
We're a small contracted company through a larger one, so my boss can't afford to provide insurance for us.
For a while, Perrin says she was on Medicaid. In 2023, she no longer qualified.
My boss suggested that I do the Affordable Care Act, and it was relatively inexpensive. It's like $30 a month.
While the cost of her insurance increased last year, she was stunned by her options this year.
My plan was gone, so they had directed me to a different plan, and this plan was going to be $450 a month.
Eventually, she found cheaper plans, but they were offered by companies she had never heard of. They also came with a major catch.
While $11, $12 a month sounded really good, the out-of-pocket and the deductibles combined were like $17,000, $175, just to go into the doctor.
She says her only option is to go uninsured.
I'm actually looking for a second job, and then I fear I'm going to burn out and end up with a hospital bill. It just seems like a lose-lose.
It's a huge challenge for so many people.
Marianne Udow Phillips is a lecturer at the University of Michigan's School of Public Health. She says the rise in the uninsured population impacts everyone.
More people will drop coverage this year, and we'll have many more people who are uninsured, which means we'll have people going to the hospital who can't pay their bills. That raises premiums for everybody who has coverage.
Perrin's message for lawmakers in Washington is simple.
We need to fix this now. What if I have to have surgery? What if I break a bone? It's scary. It makes you not want to leave your house.